Good afternoon, everyone, and welcome back from lunch. My name is Madhuri Nagaraj, and I will be presenting Mitigating the Impact of COVID-19, Efforts by the Fellowship Council to Ensure Adequate Training Experience. We have no financial conflicts of interest to disclose. However, the listed co-authors of mine do serve or have served on the Fellowship Council Executive Committee. As you guys well know, 80% of general surgery residents seek fellowship training, and of the many cited reasons, one commonly cited is the lack of technical proficiency. With the COVID-19 pandemic and the subsequent cessation of elective cases, many, including both faculty and fellows affected, were concerned that this would indeed impact technical proficiency. However, we were not aware of any objective data that was there to support this claim. So the aim of our study was to use the robust database of case logs from the Fellowship Council to analyze and delineate the impact of COVID-19 on the fellowship training experience and case log trends. We obtained de-identified case log data from 2016 to 2020. We removed program designations with 2 years or greater and program designations with less than 10 fellows across their programs in multiple years to keep the analysis relatively comparative. We also did a baseline case log analysis where we compared the 5 months preceding the cessation of elective cases from August to December of 2019 with the immediately preceding 5 months from the prior academic year from March to July. In this 4-year case log analysis, we yielded just over 350,000 cases over 5 program designations, 151 programs, and 704 fellows. When examining just the number of fellows alone, we do see a 13% drop in the number of fellows over the 4 years from 188 total in 2017 to 163 in 2020. This was reflected across all of the program designations except for bariatrics in purple in the middle, which grew by 6%. When looking at the baseline case examinations, as I mentioned earlier, we do see actually a statistically significantly higher number of monthly cases performed by fellows in the 5 months preceding COVID as compared to the prior academic year, from 42 to 46 cases per fellow per month. Now just looking at the overall case log data, on the left you can see the average total yearly cases performed per fellow over the 4-year span, and that did increase with each progressive year. Looking at the graph to the right, you can see that this was despite a large trough in April that represented a 66% drop in cases from the previous academic year in this month. You can also see in June and July of this year, 2020, there is an uptick of cases that represented a 35% increase in cases performed as compared to the previous academic year in those months. Now, specifically looking at cases per fellow by program designation, we did a direct comparison between 2018-2019 and 2019-2020. As you can see, there was actually 3 program designations that had a significantly higher number of cases performed in 2020. These included advanced GI in dark blue by 25%, bariatrics by 13% in gold, and colorectal MIS by 44% in light blue. The other 2 program designations had a non-significant decrease from 3 to 6%. When we look at those 3 program designations a little bit closer that had the increase in cases, you can see that 2020, represented in gold, had a higher baseline case performance than 2019, the previous academic year, shown in gray, which was actually lower than the year prior to that. Additionally, if you look at the graph on the right, representing colorectal MIS, you can see an attenuated trough around the time of COVID-19. This we suspect is due to their continued performance during the cessation of both urgent and malignant cases, and hence that designation having the highest growth. Looking at colorectal MIS even closer, in this graph, each line represents an individual program. You can see that in August of 2019, there is an uptick in the number of baseline cases performed by quite a few programs. That likely shows that this increase was reflected across a number of programs rather than just a few outliers. So just in total, looking at this last year affected by COVID, if you look at all of the program designations, we can see a universal trough in April, with program designations dropping anywhere from 33 to 76% of their cases from the previous years, and average cases per fellow being limited to 13 in those months. The FC, in its unique position working with collaborative societies, was able to implement some mitigating factors that they believe helped in attenuating the experience of the fellows. One of them included monthly collaborative reviews, which were attended by both presidents and leadership in those committees, where they evaluated these case log data on a month-to-month basis to identify at-risk fellows who would not achieve their accreditation thresholds. SAGES also reduced the overall requirement by 25%, as long as this was supported by a program director attesting to the technical proficiency of the fellow. And finally, the ASMBS was going to recognize cases from chief year and the first year of postgraduate fellowship practice as contributing to the accreditation thresholds. So in total, in this 4-year analysis, we see that clearly fellows and programs across the board were affected by COVID, but we now have objective data to show that with the robust recovery patterns, the increased baseline performance, and these mitigating factors, that we were able to maintain the accreditation thresholds and achieve them, generally speaking, and that 3 program designations specifically had an increase in the number of cases. This is especially timely given that COVID is ongoing and some institutions have reinstated a cessation of elective cases. We believe that these mitigating factors can serve as a guide for ongoing needs. Thank you. I'm happy to answer any questions.